Do you avoid squats because they hurt your knees? Let's talk about it. I'm Dr. Morgan Riggins. I'm a physical therapist at Opal Movement Therapy. And today we're going to talk about squats and why it's not uncommon to have knee pain during squats, but it's also not normal. And we don't have to just take them out forever. Unfortunately, every time we get up and down off a toilet, we're doing a type of squat or get up out of bed. So when people write squats off completely, I am sympathetic because it's uncomfortable and I know that's why you don't want to do it, but we also need to look deeper at maybe it's how you're doing the squats, right? Or maybe we need to modify them in a way that you can do them because it's just really hard to go through life without squatting. And of course, we'd rather that be more comfortable and you can do it with confidence and build strength with it rather than feel frustrated and have it hurt and have it irritate your knees more. So let's talk about the squat first, and then we're going to talk about strategies for them if it's uncomfortable. So one thing is just breaking the squat down, right? If I do a squat in slow motion, it is going to involve triple flexion, which means that I'm going to bend at my hips, my knees, and my ankles, and it's happening almost simultaneously. But if I go really slow, my hips are creasing, my knees are bending, my ankles are bending, for me to get all the way down into my depth, right? Now, everyone's squat will look a little different depending on their anatomy and their build. I personally have really, really long femurs, part of the LFC, long femur club, and shorter shins, which means that when I hinge at the hip, my torso is going to be a lot more forward than someone who was maybe shorter or had more proportional femur to tibia. That's a whole nother conversation, but if you look at my squat and you're like, well, wow, she's leaning really far forward. Yes, because in order for me to use my hips appropriately, that's what mine looks like, right? Whereas someone else may stay more upright and squat. If I stay upright, I can't bend my hips any more than this, and now my knees bend. So this is fine, but I can't get all the way down to where I might need to go. We've got to break down the hip, the knee, and the ankle. The knee is really just the bottom of the hip and the top of the ankle. So sometimes it's nice just to think about what the hip and ankle are doing, and the knee follows along. So my hip is bending, and my ankle is bending, and the knee follows the two of them, and then I come back up. Clinically, we see people don't take full advantage of the hip, and instead, they just start with the knee. So watch, my hip didn't really move. They just start by bending the knee and then coming up. That over time can put more load on the knee, or if you've been dealing with symptoms, it can add to it, which then would discourage you from wanting to do squats because they hurt. And so we really need to make sure that we take advantage of the hip. We're going to work on this with a couple of drills in a second, but one thing is sometimes just to do the hip piece. My shins are going to stay still. I'm going to send my hips back. That's a hip hinge. My hip is bending. I sent it back as much as I can. I can't go any further from the hip. I could from my back, but we want to keep the back rigid. So I'm just going to hinge at the hip. When I've run out of room, this is when my ankles are going to bend. My shin is going to come forward over my foot, which is okay. That is word on the street that you can't go over your toes. That's not true. In this position, I have equal hip flexion and loading, knee flexion and loading, and ankle flexion and loading. I'm dispersing the weight through each of those joints. Whereas if I just throw the knees forward, this puts more load on the knees. It makes sense, it's logical. However, it can be hard to access parts of that if you have decreased mobility, if you're stiff, if something hurts, or if you don't have the strength or the awareness of those areas. So we're gonna work on that in just a moment. The other thing we wanna think about with squats as well is the top-down orientation. So my hips, my knees, and my toes need to stay stacked as I do the squat. And sometimes we'll see a knee want to come in or a knee want to flare out, and that can be important. We'll look at it from the back as well. Sometimes we'll see knee movement and we'll see hip movement. We'll see someone shifting, or maybe you've had right knee pain for a long time, and so your body tends to go away from it. So we'll see all sorts of different movements, and we like to film it and break it down. But if you're working on this at home, let's go through the basics. If I'm having knee pain with squats, the very first skill that I need to have is how do I do a really good glute bridge? And the reasoning is when I'm hinging at the hips here, this is like the vertical version of a glute bridge on the ground. my hip is bent, right? Just like it's bent in the squat. And then if I lift up into the bridge, now my hip and my torso are in line, very similar to when I'm in standing. So if I'm holding my glute bridge at the top, this is like me standing about to squat. I have to crease or hinge at the hip to touch the floor, to hinge, and then to come out of the squat and stand back up, my glutes are gonna lift me up. If you don't feel connected to your butt muscles on a glute bridge, you are not gonna feel connected to them on a squat. This is a lower level exercise. And we have clients all the time who are like, okay, yeah, I know bridges. And I ask them, where do you feel this? And like, I feel it in my knees. I feel it here. Should I feel it in my knees? No. It's a glute bridge. So we want to feel the work in the glutes. If you have been avoiding squats because they're painful and you are doing glute bridges and you don't feel it in your glutes, that is a perfect opportunity to start working toward the concepts that will help you work towards squatting pain-free. If you can't do glute bridges without pain, then we need to break those down further, right? So if I'm having knee pain with glute bridges, the first thing is I'm probably using my quads and loading my knee first, like pushing with my knees, instead of thinking about my butt muscles lifting me up and propelling my hips forward. And so what I want to think about is I want to think about my hips here tracking up and toward my feet. So they are going up and toward my feet like so. Sometimes it can help if you change that, because what we see a lot in the clinic is you'll actually go up towards your head, and you'll notice because you'll feel like your shoulders are shrugging up towards your ears. So if you're feeling that on your glute bridge, think about changing the line of force. Can you get your hip to travel forward? And so here, my hip and knee track forward. If I'm still not feeling it in my glutes, I can adjust my foot position. If I'm really far away, then that's a lot of hammy, back of the thigh. If I'm really, really close, my quads are being stretched and they're kind of like a rubber band. They're ready to pounce. So I might feel quad right away. You can adjust to find the sweet spot where you feel like you can push with your glute more. You could also try widening the stance. Sometimes that helps. Also, if you're like, Maureen, I've tried all those things, it's not working, you can just lay flat and squeeze your buns, like literally you can see my hips rise. Squeeze those cheeks and get like 10. I actually had a professor in PT school who would make us stand up and do glute squeezes to break up the day. So this reminds me of her. But literally just squeeze your buns to make sure they're alive and well. And then come back to it and let's try to put all those pieces together. So I'm finding that sweet spot. Like here, I feel like I can push a little bit more with my glutes. I might even cup them because it's not like a super strong feeling. They're well insulated. And then as I come down, they're coming down. If I was still struggling with this, I could add a circular band around my knees so I could push out a little bit. That can help. But the goal is for the knees to be quiet. The muscles doing the work are the butt muscles, the glutes primarily, and then a little bit of hamstring, okay? That is where we want to feel the bulk of the work. I don't want you to feel strain in your lower back, and I don't want you to feel strain in your knees. If that is not working for you, then spend time on that before we progress to the squat. You also might do well with the next drill. So glute bridge is like layer number one, and then obviously we need to be able to hinge in standing. And so before we jump into the squat, we're going to practice just the hip hinge. It's hard to isolate hip movement from everything else. So I suggest walking into a bench or a chair. That way you have a little bit of a guide rail. So in this position, my shins are gently touching the bench. My feet are underneath it. Don't set up like this where I'm like pushing my knees into it, because now I'm not standing straight up. I really want you to walk fully underneath. You're gonna feel like you are one with the bench. Now in this position, we wanna isolate hip movement from everything else. So what I wanna see is I wanna see your hip move backwards and your knees and shins stay touching the bench. And then it's your butt muscles that will pull you up. This is really hard. We have an entire digital course dedicated to it, so don't be intimidated if you're like, what just happened? You may find that your hips do nothing and you just want to do your back, right? We see that a lot too. So we have to find the combo. You might try sandwiching your torso so you can feel, okay, I'm not allowed to use my back. I'm sticking my booty back. My butt muscles are stretching. They've stretched as the hip has bent. And now the glute is going to shorten to come up. Sometimes people do better with their fingers here in the hip crease. As I send my hip back, I can feel my fingers starting to get buried. And then as I stand up, I can feel how my fingers get pushed out of that crease. The other analogy I really like is here at the bottom. Instead of lifting up with the back, think about pushing the floor away. This is the second most important skill to feel the right places, right? There's really no knee movement. I'm not bending my knee actively. At the bottom of my hinge, my knee has bent, but it's relative to the hip moving on top of it. Remember, the bottom of the hip is the top of the knee. So this should not be painful on your knee if you do it well. Now, if you rock back and slam back, then we know you're cheating and using other stuff. So working on the hip hinge would be really important. If that's gone well, then you could graduate, you could come off of it. I have a line on the floor here. It's sometimes helpful to have a visual when we remove the table as a guide, and so, or the bench rather. So this line on the floor is right in the middle of my foot, right around my laces. That's just so I remember not to slam back, right? So I'm kind of thinking, okay, my weight's in my whole foot, my knee is unlocked, I'm gonna hinge at the hip, head's coming forward, and now to come back out, my glutes are shortening to bring me up, okay? So I'm gonna do a few. And if that wasn't going well, I might need to come back to the bench. If I feel connected to my glutes, I feel good about it, then we're gonna apply this to a squat. And I like to start with support, right? So these are TRX straps. If you don't have TRX straps, then you would just wanna start either in front of a squat rack so you could hold on, you could hold a foam roller, you could even do this in front of the kitchen counter. And we're gonna start with support on a bench. And so a bench, a chair, coffee table, all of that works. Keep in mind, the lower the surface, the harder it is. So I'm actually gonna bump myself up a little bit. If you notice, since I have long legs, my hip and knee are relatively level here. And so I may want to start with my hip a little bit higher. It's easier. You could certainly start here, but if you get frustrated, add a little bump. And so I can put this foam pad. If I was at home, I could find a higher chair. If I'm at the gym, I can put a circular plate, a weight plate on it to elevate it. Once I'm in this position, the TRX straps are here for a little support. I'm not gonna pull on them. I always tell my clients, use it like I'm gonna take it away from you, because I will eventually. So in this position, we wanna pre-position you at the bottom of your squat. And so when I normally sit, my ankle is just 90 degrees, because that's where it's comfortable. But now I'm like in a bucket. It's gonna be very hard to get out of this squat. So instead, we wanna flex the ankle, just like I did at the bottom of my squat previously. So here, the shin is over the laces, that's fine. I'm gonna scooch them back as far as I can without going so far that they can't stay off the ground. So the heel has to touch. In this position, that takes effort on my ankles. I don't sit like this normally, and it's the same type of effort required at the bottom of the squat. So that's already making things work. And then I am sitting up nice and tall. I'm gonna do my hinge. So I'm hinging forward, and I wanna hinge forward until I feel a stretch in the glute. And so I'm hinging way forward, and I feel that stretch, and now the glute has stretched. It's gonna be like a rubber band, and it is gonna help propel me up. I'm gonna push the floor away and come up. Now on the way down, let's go slow motion. Let's break it into two parts. Hips go back, that's the hinge. Now my ankles bend, that's the ankle portion. So we're gonna try that a couple times. You can regroup in between, adjust your feet if needed, really hinge forward, and then push the floor away. And now same thing here. You don't have the bench like on the hip hinge, so you may try to rock back, and then all of a sudden you're like, whoa, I got all this more leg on the bench. Tells me that you're rocking and shifting your weight back. So it can be helpful to kind of have a guide, like the foam is right underneath the edge of my glute and hammy. I want to try to land in the same spot. I lean forward, and then I push the floor away. And then here, instead of rocking back, I've got to think, okay, feet stay still, hips go back, shins go forward. I can put more weight through the TRX if I need it. And if I was still really struggling to feel my glutes, I might add a circular band around the knees because I'll just get a little bit of hip action. So that would be a good option. Once again, if you haven't mastered the glute bridge and the hip hinge, then your knee may make up the difference on this. So if you get to this and you're like, yeah, it still hurts my knee, well then go back and get better at the first two. But if it's going well, this would be the next progression. Just ditch the TRX, same setup, really lean forward. I like the hands here, but you could certainly counterbalance. I like to just tuck them away and then push the ground to come up. And then same thing on the way down, coming back. Once you've practiced this, it almost starts to feel clunky, like feels like two parts. So let's make it more fluid. So this time I'm gonna lean forward, I'm gonna push the floor away, and now I'm not gonna fully sit down, I'm just gonna tap it. Hips back, shins forward. And I can go slow. I'm thinking about the muscles pulling me into the squat, and now I'm thinking about my hammies, my quads, my glutes pushing me out of the squat, right? If it's uncomfortable, chances are I might be loading it more, so I want to double check, and I could always go back to adding the TRX straps. If this goes well, I could make it harder by going to a lower surface, hinging forward, pushing away, hinging back, creasing at the ankle, and then eventually we would take that away, and I want to see if I can feel the same feeling. I don't have the bench as a guide, I don't have straps. I could meet myself in the middle, give myself straps before I go completely by myself. That's always a nice option. Hips go back, head goes forward. I like the TRX when you're learning because it moves, unlike holding onto a chair in front of me. So as my hips go back, my hands can go forward. It can encourage me to hinge. Many of us have been told to stay upright. If I stay upright, mine becomes only a knee squat because I'm not able to access the hip. So the TRX can be helpful to encourage you to allow the hinge to happen. Then you could ditch that if it feels good, nice and controlled, all the while tuning into the right muscles. It's not just about looking like you're doing, it's about feeling the right things. So if you don't feel connected to those, you could also switch it up. If you felt like, wow, I really felt my glutes on the glute bridges, or I really felt them on the hip hinges, I might do a few box squats or bodyweight squats, and then come back to one of the other drills where I really feel connected to it. So there's a couple different strategies. I hope this was helpful. If you liked it, please hit subscribe and check us out on Instagram or Facebook. We post every day there as well, and then we'll put more content out. We love getting resources directly to you. Thank you.